The source of the thrombus in systemic thromboembolism is within the systemic or arterial circulation. Common sources include the left cardiac chambers, especially following myocardial infarction, left atrial dilatation, atrial fibrillation, or from damaged valves. Atherosclerosis of the carotid arteries with subsequent thrombus formation and thromboembolism is a common cause of cerebral transient ischemic attacks and strokes. Vascular aneurysms may contribute to stasis and turbulence, leading to thrombus formation in the cavity and subsequent arterial thromboembolism. An arterial thromboembolus will migrate distally and terminate at one of the systemic arterial branches, resulting in ischemia and infarction. They are a common cause of myocardial infarction and strokes, but can also cause renal, splenic, and lower limb infarcts, among others. Of arterial blood flow by arterial thrombosis and embolism often causes ischemia and infarct. The term ischemia comes from the Greek word ischo, meaning to hold back blood. In ischemia, there is deficient blood supply to part of an organ as to meet increased demands. Although the supply itself may be adequate for resting states, cells do not undergo necrosis in ischemia, but they are subjected to deprivation of blood supply with consequent hypoxia, especially when stressed. Chronic ischemia is usually compensated by developing collateral circulation from adjacent anastomotic blood vessels if they are available. And ischemia would usually progress to infarction if it is not reversed or there is insufficient collateral compensation. Infarction, however, relates to tissue necrosis resulting from the loss or sudden reduction of blood supply. Nearly 99% of all infarcts result from thrombotic occlusion or embolic events, and almost all result from arterial occlusion. Infarcts may either appear as red infarcts when it occurs in spongy organs with extensive anastomotic blood vessels, such as in the lung, or they may be pale infarcts when it occurs in solid organs with terminal arteries, such as in the spleen and kidney.